Saturday, and I'm taking my son to the vet. Wait, I'm not taking my son to the pediatrician. No, I'm taking my son to the vet. Let's find out why.
I've always wanted to be a vet since I was young, since my parents were always really good vets. And I have 2 dogs, so I really love animals, cats and dogs. They're both great. So it also saved lives, so it's really special. So I think that's why I want.
What kind of procedure are we going to see today?
A scope.
Do you know what is wrong with the patient? He's been losing weight. So we need to get GI biopsies to figure out why this patient is losing weight. It's really hard to figure out why your pet is losing weight, when they're losing weight, and then what tests we're going to do. So that is what today's vlog is going to be about. What to do when your pet is losing weight. Okay, so the first thing that we want you to know about weight loss in dogs and cats is?
I think one of the biggest things is it's easy to miss.
Yeah.
You can have a happy, healthy cat or dog that seems fine, and next thing you know, they've lost a significant part of their body weight.
And this happened to our own cat, Jeter. And I think because dogs and cats are fluffy and we're with them every day, it can be really hard to notice weight loss, especially if it's happening slowly over time. And for us, it was actually your mom who came in over Thanksgiving and said, Jeter looks a little bit thin. And we're 2 board certified specialists. And so we brought him to the clinic and realized he had lost about 3 pounds. And so a 13-pound cat going down to 10 pounds is a significant proportion of his body weight. And I think that's a really important tip when you hear the number of pounds that your dog or cat has lost, is to think about it in percentage of body weight.
Yeah, no, a lot of people say, well, it's just a pound. Well, it's a 10-pound cat. 1 pound is 10% of your body weight. That's a lot.
Right. And a 70-pound dog losing a pound is not that much, not a big deal. A lot of that can just be changes in hydration over the course of a day. So definitely you want to think about how much weight they've lost in percent to their total body weight.
And also with the smaller weight loss, it's watching trends.
Exactly.
You lose a pound here or a half a pound here, and then you gain a half pound, then it's not a big deal. But if it's a consistent trend in the wrong direction, then that needs to be addressed.
Right. So how do we know if our pets are losing weight? We need to weigh them on a regular basis. So, it's really important that, it may mean popping your animal into the clinic. And, most animal clinics will be really, will be fine if you bring your pet in for a weight check. They're not going to mind at all. So just call your clinic and say, hey, can I bring Penelope in? We just want to, check the weight. The other thing is you can, if they're small, you can weigh them at, weigh yourself, pick up your pet and weigh them and just do the math and, weigh them at home. I think that's a really good thing to do.
The other thing that we notice a lot is just noticing the backbone. You pet your cats, you pet your dogs all the time. You may notice that you're feeling that spine a lot easier. That can be a big tip that they're losing not only just weight, but muscle loss. And that's always a cause for concern. Your body doesn't just want to lose muscle for no reason. And so if they're starved for energy and they want more, they'll steal it from the muscle.
Yeah. And so again, when you're at the vet, definitely just make sure you ask, how much weight have they lost? How much weight have they gained? And keep track of it and be really proactive. And I love the owners that have a little journal and a log or, something even on their smartphone that they're keeping track of it. So again, it's easy to miss, be proactive, stay on top of it. That's our first tip. The second thing that we want you to know about weight loss in dogs and cats is there are a big bunch of number of reasons that dogs and cats lose weight.
Poor nutrition, oral disease, swallowing disorders, esophageal problems, stomach problems, intestinal problems, liver disease, kidney disease, hyperthyroidism in cats, diabetes mellitus, and then yes, of course, cancer.
So the third thing that you should know about weight loss, and we're going to talk about one specific one because I think this can be really confusing for dog and cat owners, is gastrointestinal disease or intestinal disease.
Yeah, I see a lot of cases that come to me for weight loss, and they've already been to a general practitioner and they've had an exam and blood work and urine testing, and they've ruled out all the honestly easier things that you can look into. Diabetes shows up relatively easily on blood tests, hyperthyroidism shows up relatively easily, but then you're left with all my blood work's completely normal and yet my cat has lost 3 pounds. What's wrong? and that is almost always underlying intestinal disease. If your intestines aren't absorbing your nutrients, even if you're eating well, you're still going to lose weight. And a common misconception is, well, it can't be GI disease because there's no vomiting or diarrhea and my cats or dogs eating fine. That is not true. Weight loss can be the only symptom from intestinal disease, and it can be difficult to figure out.
Yeah, so I think that's really important and worth repeating, that weight loss can be the only symptom that you are seeing at home, and your dog or cat can still have something wrong with their intestines. And to recap, your veterinarian or your internist is going to do blood work, so full CBC, chemistry panel, urinalysis, thyroid testing. We talked about in the last segment different diseases that can cause it, and then we're going to do some chest x-rays and ultrasound, looking for the different cancers, which we're going to talk a little bit more about in the next segment. But then for intestinal disease, if that's all normal, they come to you, and what's going to be the next step?
One other test that you can do, especially if you're still not 100% certain, is a maldigestion profile. Is a simple blood test that can look and see if you're absorbing certain vitamins well, if you're producing a certain enzyme from the pancreas that you need. If these tests are positive, meaning they're abnormal, they're strongly indicative that you need to head in that direction, whether it's pancreas or intestine. If they're normal, though, it doesn't rule it out at all. It still could easily be intestinal problems, and the next step would be GI biopsy.
Right. And so there's two main ways that we can do GI biopsies in dogs and cats, and that's either going to be endoscopy, which is how we started this video, right? So we were going to work today on a Saturday to do GI biopsies or endoscopy on one of my patients, and you were giving me a hand with that this Saturday, or going to surgery for full thickness biopsy. So we're not going to go through the pluses and minuses of those, but that's going to be a great discussion for you to have. It can change a little, but case by case, dogs or cats. Cats with lymphoma are going to be different than the dog that we were working up today. But, talk to your veterinarian, talk to your oncologist, talk to your internist about whether or not they recommend endoscopy, which is what we showed you today, how do we do endoscopy real quick?
Pass the scope down through the mouth. You evaluate the stomach and the small intestine visually, but then you also take biopsies of both the stomach and the small intestine if it's an upper GI.
Upper GI. And then if you need biopsies of the rest, of different organs or lower intestines or other deeper parts of the intestines, we're going to recommend that you have full surgical explore. But again, then we're going to get our biopsies, and then we're going to, be looking for things like inflammatory bowel disease or gastrointestinal lymphoma. That's what those biopsies are going to help us figure out. Right. So number 4, we're going to talk about cancer. But remember, a lot of animals that are losing weight are not coming to see me. You're going to your veterinarian, or you're being referred to an internist, like Dr. Heuter. So, Dr. Heuter, can I call you Kerry?
No.
Okay. I tried. Dr. Heuter, when are you thinking cancer when a patient comes in for weight loss?
Most of the time people come to me, they've already had the normal blood work. So at that point, I am concerned about cancer or intestinal disease. Those are always my two big concerns. And so that's where I do recommend an x-ray and an ultrasound. And I'm looking for a couple things. One is just a large mass in the chest, or maybe a large mass in the belly that's just eating up a lot of energy. So even though you're eating well, it's chewing through energy, it's speeding up your metabolism, and you keep dropping weight. Or option 2 is it's just such space occupying mass that it's either affecting the way you swallow up in your chest, so you don't want to eat as much, or it's pushing on your stomach, so even though you do eat, you seem to get full really fast, and then you don't want to continue to eat. So those two are the two big reasons. And then lastly, I'm looking for some other supportive intestinal disease. Oh, look, there's an intestinal mass. Or, oh, look, there's a bunch of lymph nodes in the or near the intestine that would fit with more like GI lymphoma.
Right, and then within the GI lymphomas, we have high-grade lymphomas and low-grade lymphomas. And the high-grade lymphomas are the ones that are developing more quickly, and then the low-grade lymphomas are the ones that are more of a slowly developing chronic disease. And so that will also depend on, did the animal lose a lot of weight more quickly, vomiting, diarrhea. But again, as we learned in the last segment, sometimes weight loss is the only symptom, and then sometimes we'll see vomiting, diarrhea, decreased appetite, or just changes in appetite as well. So our 5th tip is, so you may be waiting for test results to come back about what the diagnosis is for weight loss. And many animals that are losing weight are not eating well. And guys, I have a couple of videos on this. If you are tempting them with other foods and your pet is not eating their regular food, they are inappetent. They have a poor appetite. And I want you to go home at that visit with appetite stimulant. I have 2 whole videos that we're going to put the links below about things that you can do. Some of them are medications and some of them are just, we did this video together, about tips that you can do to help get your pet eating when they don't want to eat. But there are some great medications. So we have Entice, which is an appetite stimulant for dog, Mirataz, which is a topical ear medication for cats. We have nausea medications like Serenia. Getting nutrients into the body is so important for the immune system and so many different things. So I just wanted to make sure that you are getting those medications for your pet even before we understand what the cause of the weight loss and the poor appetite is.
That's great, as long as we understand that's not the treatment. It's something to help us, give us the time we need to find the right diagnosis and get the real treatment started.
Right, it's supportive care in the interim. So I think it's just really temporary. And an important thing to bring up, you should not go home on steroids. It's a great appetite stimulant. It's great, it works powerfully, but steroids are bad because they will mess up the diagnosis for lymphoma. So we will not recommend steroids if we think possibly that lymphoma is one of the possible causes for weight loss and appetence.
Which it's almost always on the list.
All right, Dr. Heuter, since that's what apparently I have to call him, we made it to our last tip. Often pets that are losing weight are eating normally, right?
Yeah. In fact, there are some diseases that actually they'll have an increased appetite, like
right.
hyperthyroidism, diabetes, even certain types of intestinal disease. They will have a voracious appetite, but still be losing a ton of weight.
Right, so I think that often surprises people to find out that their pet is sick, because appetite is one of the ways that we often measure how happy our pets are and their quality of life. So again, just going back to the beginning, that weight loss is important to be proactive with, to monitor, just really one of those important things. Going back to, I'm very proactive with lumps and bumps, very proactive with our pets' overall health care, and I think monitoring weight is a really important thing to keep an eye on. All right, that's it. Top things you need to know about weight loss. Thank you guys so much for watching. Thank you, Dr. Heuter, for joining me on a Saturday, no less. Do I have to pay an emergency fee?
Yes, you do. Yes,
I do. All right, so you know what I always ask you to do. Please comment. Do you like when Dr. Heuter joins me, even though he's a little bit sassy? Please comment. Please subscribe. Tell me what videos you like. If you'd like to see more medicine topics with Dr. Heuter joining me, please let me know. Thank you so much for watching, and we will see you at the next video. Have a great one.